What is an ankle replacement? Well, an ankle replacement is a surgical procedure to treat arthritis in the ankle. Most arthritis in the ankle happens after trauma, such as ankle fractures or severe sprains. Over time, the shock-absorbing cartilage in the ankle wears away, leading to bone rubbing against bone, and that causes pain and stiffness, which can impact your quality of life as severely as end-stage heart failure. In an ankle replacement, we remove the damaged joint surfaces and then replace them with metal joint pieces and a strong, durable plastic liner that allows for smooth, pain-free movement, simulating the natural movement of the joint. I used a specialized prophecy technique, which is tailored to each patient. We send a CT scan of your lower limb to the engineers who then create detailed, customized 3D surgical plans, just like an architect designing a building. And that allows us to prepare and carry out your surgery with precision. In more complex cases, or revision surgery, where the bone quality is poor, we use a stemmed implant for additional stability in the tibia or shin bone. Ankle replacements allow you to return to activities that you love, like long walks, hiking, swimming, cycling, and even playing golf. Since the joints are made of metal and plastic, high-impact activities like contact sports and running can cause faster wear and tear and may lead to failure earlier than they should. If you want to find out about an ankle replacement, do see a specialist who can go over the information in detail.